there, and welcome to installment 6 of Achieve Wellbeing. I'm Dr. Lisa Kirk Brown, retired Air Force Lieutenant Colonel, Doctor of Public Health with almost 30 years experience in preventive medicine, and disabled American veteran. At the last installment of Achieve Wellbeing, I spoke to you about nutrition and supplements, and I really hope that you were able to institute some of the recommendations I provided for you at the last installment to achieve well-being, a state of comfort, health, and happiness. Also, since last installment, I created an Achieve Wellbeing Facebook page, posted all the videos on that page, as well as a link to a hydration calculator. I posted all the videos on my Instagram, Twitter, and LinkedIn accounts so that you can have access at each of those social media sites. I also want you to reach out to me at my email if you have any specific questions, which is drbrown.disabledveteran@gmail.com. Today we're going to talk about the last element in the physical aspects of well-being, medicine. I want to talk to you a little bit about what medicine is, about what the 3 different categories of medicine are, give you some recommendations on how to get the best out of the medicine that you do choose, and then I want to just highlight some examples from my experience. So this won't be a very long installment because I'm not a physician and you all have a physician. You can go to them for more information on exactly what your condition might be. What is medicine? So medicine is really the diagnosis, treatment, and prevention of illness. It's an ancient category of work that is considered to be both an art and a science. And why do I say that? I say that because we don't come with an owner's manual. The last time I gave you an example of a properly functioning car, that the physical aspects of well-being can be likened to a properly whatever is required for proper function. Just like a car, you have to maintain the car, you have to fuel the car, you have to do certain things to the car to help it function properly. And our bodies are very similar. When we get sick, we need a mechanic, like a car, and our mechanic is the doctor. It's not that easy though. Not that taking care of cars is easy, because I'm not a mechanic and I think it's very complicated. But our bodies are unique, as I told you during the last installment. No body is the same, and we don't come with an owner's manual. So medical research is constantly ongoing and discovering new things, but translating that to each individual requires a little bit of an art, because we aren't the same. We are all unique, and one thing that works for one person in a study might not work for another person who's not in the study. And so there's a little bit of art required by a physician to actually implement some of the recommendations that are discovered in medical science and medical literature. That's where the training, the expertise, their experience all comes into play. And that's where you can also come into play as you go and research your own health and you know your body best. So my goal for you is to be your own best advocate in all of the areas of Achieve Wellbeing, all of the 12 elements of Achieve Wellbeing, including the medical part of Achieve Wellbeing. That you would be your own best advocate at your physician's office, that you would do a little research on your own, that you would talk to people and get second opinions, and actually play an active role in your medical treatment, diagnosis, and prevention. Our bodies age, and so we don't really understand exactly why our bodies age. We know by observation, though, that cells break down and cells can die. At the cellular level, our bodies are changing every day, and as we get older, our function changes, and things break down and things happen, and we can be sick. And when we get sick, we need to go to the doctor. We need to have a diagnosis. We need to have diagnostic techniques to understand what's going on. Then we need to have some type of treatment. And then we also have to have some type of prevention for further things from happening. We also need to do some early detection things like colonoscopies and mammographies and other things, which are very important to detect disease early. And so I highly recommend you to be on top of all those things. And I'm not going to go into detail on those because your physician, I'm sure, is telling you what's needed at each age as you go along, as well as which immunizations are required for your age, which is a very important part of preventing illness in the view of public health. Vaccination is what's actually changed the world as far as people dying from disease. It's the single biggest influence that we've had in medicine over the ages. So please get your immunizations as you are recommended to get them. So when you are sick and you go to your doctor, he or she is going to give you the option of non-medical interventions, medical interventions, or maybe complementary and alternative medicines. If your physician doesn't give you those options, I want you to be very well aware that you can get you can use non-medical interventions, medical interventions, or complementary and alternative medical interventions to control whatever disease or illness you have. The non-medical interventions are things like physical therapy, exercise, stretching, and nutritional supplements. We spoke about those during the last 2 installments of Achieve Wellbeing, and I think you're well aware of them. And a lot of these can actually help prevent pain from becoming out of control, fatigue from becoming out of control, and all the other. They can actually treat your illness in a very non-invasive manner. And so I would recommend that you investigate non-medical interventions right up front. Medical interventions are things like pharmaceuticals or surgical interventions. And when you deal with medical interventions, I have a few recommendations for you. I want you to be very aware that all of them come with risks and benefits. And so I really want you to discover what the risks and benefits of those medical interventions are. Ask your doctor what the risks and benefits are to each intervention that's prescribed to you. Do some of your own research before you decide to put any of that into your body or do any type of surgery. Get a second opinion. It's very important to get a second opinion. You can get second opinions even online nowadays. So go and get a second opinion. Use help boards that are out there to understand what the treatment option is, what the pharmaceutical or surgical intervention are, and how they might be risky to you or how they might benefit you. Some of the help boards are very, very helpful. Obviously, each person is unique, so you're going to see a gamut of responses on any of those sites. But really understand that you know your body best, and you probably intuitively can understand what's going to work best for you as far as a medical intervention goes. Be your own advocate in the doctor's office and be sure to pulse him or her for other types of options medically. Is there a non-surgical or a non-pharmaceutical way to treat this illness or injury? And then remember that there's new information constantly coming online, that medical research happens every day in this country, and it's very important for you to realize that what happened 15 years ago, 20 years ago, is not necessarily the only option for today. And I'm a perfect example of that. When I was diagnosed with MS, I was recommended to be on one of 3 drugs that were available. All 3 were injectable drugs that I had to inject myself into my body. The medication that my doctor recommended I didn't take. I took a different one because it just fit into my lifestyle better. And I'm very thankful that I chose that one because it worked well for me for the 5 or 7 years I was on it. However, nowadays there's 15 different drugs available. So it's always changing and there's new information all the time. And so just remember that someone who had your diagnosis 10 or 15 years ago may be a little behind as far as the most recent research that's out there and available. And then finally, complementary and alternative medicine. You should arm yourself with the knowledge of these complementary and alternative approaches prior to going into your doctor's office so that you can have a coordinated medical intervention for whatever illness you're facing. The complementary and alternative medicine approaches are being investigated by NIH and are known to be efficacious for symptom management and they're known to be a wonderful complement to the pharmaceutical or surgical interventions that a doctor provides for you. I would not lean only on complementary and alternative medicine, and I would not lean only on medical interventions of pharmaceuticals and surgical treatments. I would try to do a blended approach, a coordinated approach to whatever illness you're trying to treat. So for me with MS, I do massage and other types of complementary and alternative medicine, which are very efficacious for my illness, and I take the medicine that I'm prescribed by my doctor. What are the different types of complementary and alternative medicine? There's 5 categories at NIH. Whole medicine, which are naturopathy and homeopathy, like acupuncture and massage. Mind-body medicine, which is biofeedback and meditation or hypnosis. The third one is biologically based supplements and herbs, which I talked to you about. The fourth is manipulation and body-based, which are touch therapies, basically chiropractic, osteopathic, and massage. A DO would be an osteopathic doctor that would provide you some intervention on the touch of your different parts of your body. And then the fifth is energy medicine, chi or prana, other things where the force field around your body is investigated and treated. And so I would encourage you to learn about those different approaches and complement your traditional medical intervention at your doctor's office with these approaches. Always check interactions, side effects, and risks. There are risks to complementary and alternative medicine. There are risks to non-medical intervention. There are risks to medical intervention. So of these 3 categories, always talk to your doctor and make sure that you're providing for your well-being, your comfort, health, and happiness by understanding what you're putting into your body or doing to your body. So always try to get a good understanding of what the risks and benefits are of each of the interventions you choose, whether they're non-medical, medical, or complementary and alternative. Talk with your doctor and be sure that you're not causing undue interaction or unruly interaction between the 3, rather. Make sure that you understand what the risks and benefits and interactions are. Use the app I told you about, drugs.com or Hippocrates, to understand the risks and interactions between supplements, pharmaceuticals, and herbal supplements. I'll always make sure that you check that because they can interfere with each other and they're known to interfere with each other. I want to make a disclaimer about cannabis, medical marijuana. I live in a state where medical marijuana and recreational marijuana are legal, and so there's a big temptation for some people to run to that intervention, and I understand why. There's some good documentation, or at least anecdotal evidence, that it helps pain support, pain management, and other things. And so I really think I should say that I'm not against medical marijuana per se. I really don't have an opinion about it, except I know that there have not been a lot of medical research studies on the risks and benefits of medical marijuana for different conditions that have been accomplished by non-biased entities. Most of the research I've seen out there up to this point has been done by medical marijuana suppliers or manufacturers. And so I take a little bit of a more conservative approach with that because I don't like to put anything in my body that hasn't been properly researched for the risks and benefits. So completely up to you, but know that the research that's currently available is really not medically to the standard that I was talking about in my earlier installments, where they've actually done unbiased research on a level that's par with medical science to understand what the risks and benefits are. We know that there is a risk of smoking marijuana that may be greater than smoking regular cigarettes that are filtered. So please be aware of that and tuck that into the back of your mind. And all I'm going to say is if you want to try it, please go ahead and do so. But be careful with that. Finally, I want to make just one last note about medical interventions, pharmaceuticals that is. So the risks are listed on each pharmaceutical on the sheet that comes inside the package of the drug. And I want to really stress to you to read the fine print in on those pamphlets, the pharmaceutical pamphlet. It's very important to understand that. I have two examples. One is my friend Karen, who lives in England. She was prescribed a drug that was for, I think, blood pressure. That's kind of irrelevant, but she did not read the fine print on it, and neither did her doctor or her pharmacist, because she suddenly, about a year into taking the drug, started passing out and spontaneously falling. And she cracked her head, and it was very dangerous. They thought she might have Parkinson's disease. They thought she might have all types of different things. She went through a whole battery of tests, diagnostic tests, for this illness that she was experiencing, this sickness. Turns out, after 2.5 years, she read the fine print on this medication, and it said could cause spontaneous falls and blackouts. She stopped taking the drug and consequently has not had one fall since. So please, please, please read the fine print and know what you're putting into your body and what the potential risks of that drug are. For me, personally, I now have lupus because my interferon for MS, I took a drug called interferon for years. It forced my body into lupus. I have a second chronic illness now because of the drug I was taking for MS. And I was aware of that risk, but never thought it would happen to me. So let me be an example to you that you don't want to mess around with these drugs that you're putting into your body. Be very careful and do as much as you can with non-medical approaches and complementary and alternative medical approaches to offset the need for some of the pharmaceuticals, the medical approaches that you put into your body. So finally, thank you so much for watching installment 6 of Achieve Wellbeing. I really look forward to hearing from you and having comments about the Facebook page or the Instagram or Twitter, or any of the videos that we've put online so far. And then join me at the next installment where I'm going to interview a young lieutenant in the Air Force who's the epitome of physical well-being. Hopefully he can share with us some of his recommendations on physical well-being and what he's done with physical activity and rest, nutrition and supplements, and medicine. Again, I thank you so much for watching and Achieve Wellbeing,